So today we're here with Dr. Shiromi. She's a GP in the mental health space. We've done a 3-part series covering all of the questions you might have engaging with a GP. So we're looking forward to sharing it with you today.
It is frustrating, but it is very normal to have to wait to see a psychologist when your GP hands you that mental health care plan referral. We're working in a bit of an under-resourced health system right now. In Metropolitan, it can be a wait of 4 to 8 weeks, but regionally, sometimes people are waiting for months on end. The scary thing here is that treating mental health is actually time critical. That overwhelm and that self-doubt and that disengagement can happen while you're there twiddling thumbs waiting to see the psychologist. The key here is staying engaged, doing all the things, getting better while you wait to see the psychologist. We've got a great download called the Mental Health Action Toolkit, which you can check out, and that goes through some really helpful tips and advice to help you get the ball rolling with lifestyle management, with practical psychology skills, learning some meditation and some things to keep you ready. And that effectively preps you for accelerated progress when you do go to see your psychologist. Look, unfortunately, it can cost money to see a GP or a psychologist for your mental health. And I more than acknowledge that a lot of us are struggling now when it comes to finances and the cost of living. I think it's important to look at mental health and see that not seeking help can also come as a cost. It can come as a cost in terms of your concentration, your productivity, feeling fatigued and not having much energy, and the impacts of all of that. Does it mean increased sick days or time off work, or does it potentially reduce employment opportunities? It's so important that we value mental health and the impact that it has on our everyday lives and our productivity. It is so important that when you get that GP referral to see a psychologist or a psychology provider and you're waiting around, that you keep the ball rolling, because otherwise that self-doubt and overwhelm can creep back in and you can actually disengage from care. It's not unusual to sometimes hear that people have not followed through and seen their psychologist in that wait time. So it's so important that you get on board in terms of doing the lifestyle activities, learning practical psychology skills and getting that momentum. You'll start to feel better and then you get positive reinforcement. It also means that when you do see the psychologist, you've already got some skills, you're already starting to feel better and you can hit the ground running. It is really normal as a GP to hear someone say, "Nah, doc, I don't think I need that referral to a psychologist. I think I can just chat to my girlfriends or chat to my mates after work." And the fact of the matter is that is not the case. Most certainly, I must admit, as a GP, when I hear that, I am kind of happy about it because it means that you've got a great social connections around and you've got mates looking after you. But I'm not referring you to coffee chat. I'm referring you to a psychologist who is studying years at uni to be able to give you evidence-based talking therapy to get you better. This is evidence-based research to change the way we view the world, to improve our mental health frameworks, and to help you actually start reducing symptoms of feeling sad and hopeless and improving concentration and productivity. So no, it's a little bit different to your friend chat. It takes a bit of time sometimes to feel better when you do start to see the psychologist. And that can feel a bit disappointing, but you've got to stick with it. Look, mental health issues didn't come up overnight and they generally don't get fixed overnight. You've got to stick with it, put in the work, and we do see it get better. There's so much evidence behind it. It's very normal when you see a psychologist to walk out with varied feelings. You may feel happy and elated that you've been able to speak to someone, you've got the ball rolling. You may feel a little bit overwhelmed in having discussed everything. You may feel a bit tired and exhausted. It's important to have and understand that you may have different feelings and maybe they don't meet with your necessary expectations. It's important afterwards to catch up with family and friends who can motivate you and look after your mental health space and let you know that you're doing the right thing and seeking help and getting better. We've got a great resource called the Mental Health Action Toolkit, which you can access, that'll go through some really practical tips to keep you motivated and keep you going during that tricky time until the psychology seems to work and you start to get that positive reinforcement from all your hard work. It's so important to stay active and engaged while you're waiting to see the psychologist. There is so much you can do that's self-directed learning and self-directed practices. So you might decide to see a GP or a dietitian or a physio to give you an exercise plan. These things are really important. That's exactly why we came up with the Cloud GP. We want our patients feeling better even before they see the psychologist. We want them learning lifestyle skills, practical psychology skills like CBT, problem-solving therapy and meditation, so that you're doing things, and what you'll find is you start to feel better and then that builds positive reinforcement. So before you see the psychologist, you're already starting to feel better and you can prep yourself for accelerated outcomes. It is so important to tackle lifestyle when it comes to managing your mental health, and you can do this even before you see the psychologist. Often with lifestyle, we all feel a little bit overwhelmed. Where do we start? Maybe we don't have the perfect diet, we're not exercising too much, and maybe our sleep hygiene is not great as we scroll through our iPhone in the evenings. The key here is just to pick one intervention, one small thing, and then build from there. So you might decide to drink more water, or you might decide to do some meal prep on the weekend, so you're taking a healthy lunch to work every day. And then next week, you can build on that. We've got a great resource called the Mental Health Action Toolkit, which will help give you some practical advice to feeling better while you're waiting to see a psychologist. Look, when it comes to psychological therapies, it is important to see someone one-on-one because psychology therapy is tailored to you, the individual. That doesn't mean you need to sit around waiting to see a psychologist. There is so much you can do in that time. You can learn lifestyle interventions, and even within psychological therapy, there's so much you can do. You can start to understand CBT or cognitive behavioural therapy, start to understand that maybe some of the ways in which you view the world maybe aren't very helpful and gain insight into the way in which you think. You can start meditation practices. It's important to work hard to learn things yourself during that wait so that when you do see the psychologist, you can hit the ground running.